Good morning, everyone. This is a really fantastic morning in Seattle. You know, as Seattle grows, we have to make sure that we can protect our ability to deliver both emergency services and non-emergency services. We're taking a huge step forward today with the launch of Health One and the team that will be operating it. Beginning this morning, this team, trained specifically by the Seattle Fire Department with both firefighters and civilian social work specialists, will be responding requests for a range of things. You know, today we have only one choice. When we send out Medic One or a rig, if someone needs help, they can either put them in the back of an ambulance and take them to ARPA-View, or that's their choice. So today we're going to have a new thing, and Seattle was the area that really pioneered Medic One. It became the national standard. Everyone in America knew that Seattle was the best place to have a heart attack, and we've seen that increase everywhere across the nation. I think rolling out this today, I have to thank Chief Scoggins for his leadership, Local 27 also for theirs, to see that there's this need on our streets. We want better outcomes for everyone in the city of Seattle, and Health One will become the model so that when we come, you have the two specially trained firefighters together with a social worker who can respond to low acuity calls but non-emergency services. And when they get there, if it is an emergency, they can make sure they get the person in the hospital. But sometimes people just need to be connected with their social worker, with their treatment plan, with any of the range of things that we need. We know that every day the Seattle Fire Department has become almost the healthcare provider for the people experiencing homelessness. This is a step where people in our city, when they want to know what can I do to help somebody, if it's not a 911 emergency, what do I call? Our dispatchers will be trained, and then we will be able to send Health One. I really want to thank the people who are involved in this. They have made sure that when we did this, it was going to respond to what we needed in our city. I really want to thank Chief Scoggins for his leadership on this, and also Councilmember Bagshaw. As many of you know, she's decided to leave our city council for other challenges. We will miss her leadership, always thinking about how do we make our downtown core more livable, more humane, and give those responses to people that they deserve in a city of our greatness. And so with that, I'd like to turn this now over to Chief Scoggins, who will be talking about what Health One will be doing.
All right. Thank you. Thank you, Mayor. I would also like to invite up Councilmember Bagshaw to say a few words.
Thank you, Chief.
I'm real brief.
I appreciate that so much. Well, our mayor has said so much that has been in my heart for the last year. And we created this idea of a low acuity response thanks to Chief Scoggins and thanks to Local 27 and the many people who are behind me, because what was happening was somebody would call, and I use DESC, our Downtown Emergency Services location, as an example, and there would be an individual who was struggling. They would make a 911 call, and so we would have not one truck, but maybe two, not just 3 or 4 people responding, but sometimes 8. And those trucks would park right on 3rd Avenue where all our buses are, and it wasn't making sense. And to be able to have the right response to an individual who needs it, that isn't an over response, is what our goal was. And with this low acuity, many of our firefighters are trained for what we call the high acuity. They have to get involved in our fires and in the heart attacks, but many of these low acuity matters are people that we see on the street day after day. So this is a program that has not just been created here, we built on other models nationally, but I'm so proud and excited to have Health One out on the street. It is not only going to address the needs of the individuals, but working with John Ehrenfeld, he's over here hiding with it behind his beautiful red tie, we know what needs to happen. And as Dan Satterberg, our King County prosecuting attorneys have said, we know what works, but what works is at capacity. So we're trying something new. And this is it. I'm so excited that this is heading out today. Thank you, Chief Scoggins, for making it happen while I was still here.
Absolutely.
And I appreciate that very much, and glad that you are all here to see it today. Thank you, Mayor. Thank you.
John,
Thank you, John.
John, can you come up if you don't
Oh,
mind?
yeah.
So good morning. You know, today is a really exciting day for the Seattle Fire Department to really expand our mobile integrated health platform. And that's what we really view Health One as. This is going to complement a number of other programs that we have established over the last couple of years. And I've asked John to come up so you can actually see the person, the architect, who's really behind doing a lot of the work. When we set up our nurse lines for some of our high utilizing shelters, it was John who built those relationships. When we set up our taxi voucher program to get people to where they needed to be, it was John behind that work. When we brought on our social worker to help with our high utilizing patients and our high utilizing facilities, it was John who developed the training and went out and trained these facilities and brought on Ashley to actually do the follow-up on our high utilizing patients. And we saw all of those things work really well. Here's an example. When Ashley made contact with a high utilizing patient, those calls reduced by an average of 3 times per quarter. That's a significant impact when a person's calling 911 on a daily and weekly and monthly basis. All those things are really important. We saw the need to continue to expand our mobile integrated health platform with our Health One model, and we're really excited about today. Many of you may know 49 years ago, our Medic One program was started. March 7th, 2020 will be our 50th anniversary of running that first call with our Medic One program. November 4th, 2019 will be the day we run our first call with our Health One program. So a little bit about this Health One program. We're excited. It's going to serve those people who don't really need to go to an emergency room. A person could be having a mental health crisis, and our firefighters and our social worker will be able to meet them where they are to get them where they need to be. A person could be going through some substance abuse issues. We have the resources and the contacts to get them to where they need to be. A person could be on the street and just needing some help or needing guidance to a shelter. We're going to get them to where they need to be. This unit is going to be in service from 9 a.m. to 7 p.m. daily, and that's strategic by design because most of the clinics and the different care facilities are open during those time periods, so we'll be able to get them there. That's also important. This unit's going to be operating in the downtown core of the city along with Capitol Hill while we run our pilot. But we're really excited, and we know this has the potential to really grow and spread this all over the city. And that's going to be exciting for the city of Seattle. What we know is about 42% of our BLS calls right now don't need to go to an emergency room. Well, what does 42% equal? Each year we run, in 2018, we ran about 79,000 EMS calls. About 19,000 of those EMS calls were ALS calls for service, where our medics went, advanced life support was needed. About 60,000 calls were BLS calls, where we responded with an aid car, a ladder truck, or an engine, and about 42% of those calls didn't need to go to the hospital. That's a really big number. So our goal is to test this model, expand and grow this model so we can get people to where they need to be. We know that people need help. We just have to figure out how to get them there. And that's why we're excited about the expansion of our mobile integrated health platform. This program is also going to complement our vulnerable adults program. So our firefighters go inside of a home and they see someone needing additional care and follow-up. We have a social worker working with us where we're actually doing follow-up there too. So we're excited about today. I can't thank Mayor Durkan enough for her support, and Councilmember Bagshaw and all the members of the council for their ongoing support, and we know this is going to be a positive step in the right direction for getting people to where they need to be. Thank you for coming out this morning, and if you have any questions, please go ahead and ask them.
Chief Scoggins, do people call Health One directly, or will it be up to a dispatcher to take the call from presumably 911 and decide that instead it should be a Health One unit?
As we grow the program, people will be able to call Health One directly as we launch on day one. Our dispatchers have been trained. They've been given additional triage protocols, so they are going to actually be filtering calls directly to Health One starting this morning, starting very shortly. Yeah, so that's a good thing. But as we grow the program, we're going to have a direct number, or the firefighters are going to be able to call them directly when they're seeing things, and they may be on another call. They'll be able to call them directly.
Was it 811?
We don't have that established yet, but we'll take that into account. Any other questions? So
Let me just add
Yes,
something real quick,
absolutely.
Chief. First, you want to tell everyone what BLS is?
Oh, yes, absolutely. So BLS, basic life support. We have basically 2 tiers of EMS in the fire service. ALS, advanced life support. Those are the traumatic events, those cardiac events, those strokes, and all those really significant medical emergencies. BLS is a lower level of a medical emergency. Could be a broken leg. It could be just not feeling well. It could be a variety of different things. So there's 2 levels. We've just actually created a 3rd level with our mobile integrated health platform.
Thank you, Chief. I just want to add a couple of things to that. It's really important that we have, working with this chief and with Chief Best, we need a spectrum of services available in our city core. We need our police to be able to respond to true police emergencies, our firefighters to be able to respond to true fire emergencies. By creating programs like this, we will free up our resources so that they can really respond to those collisions or life-threatening emergencies or public safety emergency. Other things that have been proposed in our budget to complement this, for example, our shelters are one of the #1 places both police and fire respond in our city. They take up a significant amount of resources. So we proposed in the budget for our largest shelters to put a trained nurse there to help be able to navigate those situations, and then to create this program for low acuity for the streets. Working together, we're hoping that together with the Nurses Lifeline that we're funding as well, that more people will be able to have a resource to say, what do I do if someone just needs help? I don't know what to do when I walk by someone experiencing homelessness that seems to be in crisis. We want to be able to answer that question, but also if there's a true public safety issue, we want to make sure police can respond to that as well. So funding that whole spectrum of issues in our budget was really important. My budget also has increases for Health One. As we do this, we are going to be looking at the data to determine whether we want to increase the hours of the initial one or perhaps add a second one. We really want this to be responsive to the need on our streets, and I'm really looking forward to this next step. So any other questions?
Will these operations be out of here, or how are they?
Yes, the unit will be responding right out of this stall right here. But what we imagine is once they leave, I'm sorry, the unit.
Start over.
Yeah. The unit Health One will be responding right out of here, out of headquarters. But what we imagine is once they leave in the morning, we probably won't see them until the end of the day because there's so much of a need out there. They're probably going to be going from patient to patient to help them out.
Can you give us kind of like a scenario, like you did before, but just kind of walk us through each step as, you know, somebody sees, like you said, somebody on the street, or you say, well, you need help, buddy, and then what do? They call 911 still, and then
Sure.
walk us through the response.
Sure. What happens every day is someone could be on the street and someone goes by them and they appear to be in need of something. They call 911, our dispatcher gets that call. Those steps will still happen today. Our dispatchers has additional questions that they will ask, just like they do to determine if it's an ALS call or a BLS call. We now have a 3rd level of call. And once our dispatchers go through those protocols, they would say this is appropriate for Health One. Then they would dispatch Health One to the scene. Health One will not be responding with lights and sirens. These are not life-threatening emergencies. They will drive to the incident, find the patient, and then they will go through a series of assessments. First, to make sure they're medically okay, and that's why our firefighters, they do this every day. They do this very well. Firefighter Weber and Firefighter Young right here, every day. So they'll do that. And then they'll start to get into the deeper line of questionings and try to root out what the problem is. Now, if it's a person having a mental health crisis, our social worker and our 2 firefighters are going to be right on point to first try to calm the situation down and then start to get on the phone to figure out, we can't leave them here. Where do they need to be? They're going to have the ability, if they're ambulatory, they'll be able to put them in the vehicle and drive them to that space. If it's a lower level medical emergency that can be met with an appointment at a clinic, they'll be able to call the clinic directly, tell the person at the clinic, this is what we have. Can we set up an appointment so this person can get there? They'll have tools in their toolkit to, if they need a taxi voucher, they'll be able to get them there. If they need to put them in the vehicle, they'll be able to take them directly. If it's a person, that same scenario, and they need a shelter bed, they'll be able to call and triage the shelters and figure out which one is the best fit for them based on their conditions, and then they'll be able to take them there. So all those are great options for us, and all those are keeping those 911 assets available for that significant medical emergency, that significant traffic accident, or that fire that may occur.
Will police also are they trained in how to distinguish what levels might be?
Well, our firefighters triage these things every day. PD is a great partner with us. Chief Best and I, we communicate all the time. If our firefighters on the street need to call PD for assistance, they do that every day. So they know how to do that already.
Then how many firefighters here?
We'll have 2 firefighters on the vehicle with our social workers on the vehicle.
And Chief, if upon responding, Health One finds that it is in fact a medical emergency, do they then have the ability to transport, or would they make another call? What kind of rig is going out?
So here's the beauty of the whole system. These firefighters are used to responding to ALS events and BLS events and traumatic events every day. If they get there and a higher level of care is needed, they'll put the call in to get the additional resources coming. But the beauty is these firefighters are already trained to deal with that. So they will stabilize the incident and the event, so when the other resources get there, package them, get them in the unit, and get them on the way. So all those are our options. It's which option do we use?
All right.
All right. Well, thank you for coming out this morning. One thing that we wanted to do this morning was we're going to have Firefighter Weber officially put Health One in service, and so he's going to make the call over the radio and make that happen.
You got to put it by the mic so they
Put it by the mic. That means you have to come on.
Yeah, I'm coming. I'm just making sure I'm on the right channel. Dispatch from Health One.
Go ahead, Health One.
Dispatch, place Health One in service, available in quarters.
Hampton. Okay, Health One in service, available in quarters.